The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the 48th Bi-Monthly Breastfeeding Coalition's webinar. I am Kinkini Banerjee, the Coalition's Relations Manager at USBC, and I'm so glad to have you join us for this session. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity and by USBC. The webinars are referred to as the 222 and are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. And the purpose of this series is to bring together breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. As you know, we alternate the sessions, so we bring you one webinar with a national focus followed by one that highlights a state coalition successes. Last time we had a terrific session by the Kansas Breastfeeding Coalition. Coalition members and breastfeeding advocates from across the country can join us for these national webinars. The announcements are sent through the USBC's Coalition announcement list. If you're not already on our mailing list, you could go to the quick link section on our homepage and sign up for news and alerts. This national webinar will be followed by regional calls. So for those of you who will be participating in the regional calls, you will need to dial your state's call-in number, and your state's designated contributors handle the call-in numbers for your coalition. I'll now go over some of the webinar logistical details. The recordings of this and past sessions can be found on the coalition's webinar page, and you'll have that information either on the webinar confirmation email, or you could go to our website, and on the right side you'll see a section called quick links, and if you scroll down, the fourth item is the bi-monthly coalition's webinar. If you click on that, it'll take you to the webinar page. For today's session, all attendees are in listen-only mode, and we encourage you to submit your questions during the presentation. So you can type your questions at any time, and I'll pass them on to our presenters during the Q&A period. We usually keep about 10 minutes for question and answers at the end of the session. So here's how you do it. You should see a control panel on the right of your screen. If you don't see it, it might be minimized. What you need to do is find that orange tab with the white arrow and click on it, and it'll pop the control panel out. And if you scroll down, there's just under the audio section is a tab for questions. Click on that tab and it'll expand and open up a text box for you to type your question in. If you have any audio or tech problems during this broadcast, please send your email to office@usbreastfeeding.org and someone will be able to help you. And that brings me to today's session, making the case for a targeted approach to racial equity. Hosting a webinar during National Breastfeeding Month makes us want to bring you something extra special. And we are so delighted to highlight today the critical work being done by the Black Mothers Breastfeeding Association. This session, we hope, will help us recommit to closing the wide gap that exists in breastfeeding support. Our presenters today will help us understand the difference between equality and equity in breastfeeding support. We learn how to classify barriers to breastfeeding and understand, are they historical, are they societal, are they social? We will hear how each one of us can play a role in eliminating inequities in breastfeeding support. And coalitions will understand why we need to do more now to increase culturally appropriate breastfeeding support for Black families. I am delighted to introduce our presenters. Kidada Green is the founding executive director of Black Mothers Breastfeeding Association, or BIMFA as it's called. She is a Kellogg Foundation Community Leadership Network Fellow and works tirelessly to increase breastfeeding rates for African Americans. Ms. Green was recognized as Healthy Child, Healthy World's May, Mom on a Mission. Recently, she successfully completed a fellowship with Enterprising Health. She holds a bachelor's degree from Michigan State University and a master's degree in the art of teaching from Oakland University. Kidada Green is a devoted wife, mother, and educator, and we are so glad to have her present today. Our second presenter is Kendra Rouser. She is a community activist for children and babies and currently serves as president for Daphne's Doves Foundation, a Detroit-based nonprofit organized to help children of murdered parents by providing counseling, tutoring, scholarship, and mentorship. During founding and working extensively for the Daphne's Doves Foundation, Ms. Rouser began to increase her community work and became involved with BIMFA. She's now a program coordinator for the Black Mothers Breastfeeding Association and extends her knowledge in community work. She rallies to increase the awareness of the benefits of breastfeeding throughout the African American community. And we are so glad to have both of them with us today. And so with that, I'm going to turn it over to our panelists. Take it away, Kidada and Kendra. You might need to unmute your line.
Hello? Uh-oh.
We can hear you.
The camera. Okay, yes, hi. Welcome. I'm just going to pull up the slideshow. Thank you for joining for what I hope will lead to an enlightening and insightful opportunity for discussion and action. I want to give special thanks to the United States Breastfeeding Committee for helping to put this together. Today, we will make the case for a targeted approach to racial equity in breastfeeding support. I share this as a special moment with you as this is my first time presenting an online recorded conference. So hello. We have set forth these outcomes to be reached throughout today's presentation. To identify health disparities that are affected by low breastfeeding rates, to define the difference between equality and equity in support, to classify barriers to breastfeeding as historical, societal, or social. The goal of this presentation is that institutions will understand why they need to do more now to increase culturally appropriate breastfeeding support for Black families. In this presentation, we will make the case for a targeted approach to racial equity in breastfeeding support by exploring some facts and national statistics. We will then look at the difference in equality versus equity, look at the astounding facts about who it affects, give examples of our presentation, and give examples of the historical, societal, and social barriers. So before we get into the presentation, I'm going to tell you a little bit about myself. This is Kidada speaking. I'm going to tell you a little bit about myself and what led into how BIMFA came to be. So I am a mother, a wife, a community activist, educator, and founder of Black Mothers Breastfeeding Association. So you'll hear us refer to that as BIMFA. It's just easier. So BIMFA has a vested stake and demonstrated commitment to improving the lives and conditions of vulnerable children and families. We provided service and leadership in many capacities. I first started as an educator of elementary students for over 13 years with Detroit Public Schools. And during my tenure, I served as a teacher, an instructional leader, and in the capacity of a literacy coach and an instructional specialist. Meanwhile, I birthed my first child, Anaya, and that miracle of life sparked a new passion, first food. Throughout the time that I spent nursing Anaya, I quickly realized that there was very limited societal and social support for breastfeeding mothers. I had also noticed that there were few people within my own family who could, through personal experience, connect with my breastfeeding stories, celebrate breastfeeding triumphs, or offer suggestions for breastfeeding troubles. So therefore, I began to build a network of social support through personal friendships and the use of social media. It was through these experiences and further research that I realized the lack of breastfeeding role models and multi-generational support was commonplace for other Black women in my community and nationally. I went on to learn that there were multitudes of historical, societal, and social barriers that block access to first food for Black babies. And as we go through this presentation, we'll look at some of those historical, societal, and social barriers. So although I had built a personal network to hurdle these barriers and successfully breastfeed my child, I believe that it's unfair to place a woman in an environment of isolation and expect for her to independently hurdle roadblocks. So I decided to expand my personal networks and forge grassroots efforts to engage a community of mothers for social change to eradicate racial disparities in breastfeeding rates for Black babies. So I realized that there was a need for this, and to shift culture, to change sentiments about breastfeeding so the mothers can feel supported where they give birth, live, work, play, and worship. And thus, Black Mothers Breastfeeding Association was birthed to reduce racial inequities in breastfeeding support for African Americans by building foundational networks of support and strengthening systems to overcome historical, societal, and social barriers to breastfeeding success. Through BEMFA's leadership and the support of the community, BEMFA has gained the trust and respect of families, first and most importantly, along with local community-based organizations, local hospitals, national agencies such as the Center for Disease Control, the U.S. Office of Women's Health, and the U.S. Office of the Surgeon General. So what do we envision? We envision positive cultural sentiments about breastfeeding, multi-generational breastfeeding support, and encouragement within the African American families and neighborhoods. So I'm wise enough to understand that we can't do this alone. We need the support of organizations and agencies such as yours so that we can approach this with a community approach. So you're looking at a screen that says making the case, and that's what I'm here to do, is to make a case for you in regards to a targeted approach to racial equity in breastfeeding support. So we're going to set the stage for our work by exploring our current state as a nation when making this case for a targeted approach. So the United States infant mortality rates are alarming. Black babies are dying at more than twice the rate of white babies before their first birthday. The United States infant mortality rate took a decline of 10% from 2005 to 2010, and from 6.86 infant deaths per 1,000 live births in 2005 to 6.14 in 2010. And while the nation has moved towards improving infant mortality, this disparity is still existing. The lives of Black babies are at risk. In 2008, the overall U.S. infant mortality rate was 6.61 infant deaths per 1,000 live births, with differences by race and Hispanic origin. The highest infant mortality rate was for non-Hispanic Black women. 12.67 Black babies die per 1,000 live births, at a rate 2.3 times that for non-Hispanic white women. it is quite obvious that this is a national crisis that affects the lives of us all. The death of an infant is devastating for the family, the community, and the nation. The death of a child is a profound loss, not only to the child's parents and family, but also to the larger community. The death of an infant affects us all at the soul. So I'll take a moment to bring this closer to a community level. So I'm here in Detroit, and according to the Detroit Fetal and Infant Mortality Review Program report of 2008, in Detroit, which is a predominantly black city, 47% of the infant deaths were due to short gestation and low birth weights. Very low birth weight infants receive unique health benefits in their mother's milk that are not available in commercial formulas or pasteurized donor milk. Although the benefits of human milk are well researched and documented, mothers of very low birth weight infants are confronted with many challenges to the initiation and maintenance of lactation. According to a study done by Dr. Beverly Rossman and Paula Meyer of Rush University Medical Center in Chicago, very low birth weight infants are 3 times more likely to be born to African American women, who are less likely than other populations to initiate and maintain lactation. So Rush uses a community-based support and resources as their method of hurdling these barriers. Now let's look at the slide in front of you about childhood obesity. So since 1970, the prevalence of obesity has more than tripled among children from 5% in the early 1970s to 17% in 2010. And so although the prevalence of obesity is high among all U.S. population groups, substantial disparities exist among racial, ethnic minorities and vary on basis of age, sex, and socioeconomic status. The National Health and Nutrition Examination Survey of the United States between the years of 1999 and 2010 revealed the following childhood obesity rates. A total of 17% of children in the United States between the ages of 2 and 17 are considered obese. 15% of white males, 18% of black males, 13% of white females, and 22% of black females. And although the specific causes of these disparities have not been clearly identified, it is likely that they are associated with complex social and cultural factors that affect obesity-related behaviors. One possible contributing factor is that the rates of breastfeeding are lower among non-Hispanic black women compared to non-Hispanic white women. The health of American children is being threatened by overweight and the conditions that may stem from this problem, such as elevated blood pressure, type 2 diabetes, and psychosocial problems. In 9 studies done by Arnaz and Owen, initiation of breastfeeding was associated with the reduced risk of pediatric overweight. They found that all 9 of the studies show reduced odds for overweight among children who are breastfed in comparison with those never breastfed. The meta-analysis of these 9 studies showed initiation of breastfeeding resulted in significant overall reduced risk of overweight. The duration of breastfeeding influences its association with pediatric overweight, as well as exclusivity in breastfeeding. So we have explored the infant mortality and obesity rates for our nation with an emphasis of focusing on black babies. We know that our babies are dying at twice the rate of white babies, or more than twice the rate. And we know that breastfeeding tremendously affects the critical health rates. Let's look at the rate at which black babies are breastfeeding in this country. And at the end of the slides, I have a list of resources and citations that we use. So according to a national immunization survey, 54.4% of black babies are ever put to the breast even one time. And by the time black babies, so if you notice at 6 months, this rate drops dramatically to 26.6%. And by the time black babies are 12 months, the number is even more alarming. Almost as low as 1 in 10 babies are still breastfeeding. So what's the big deal? Why is breast milk so important to African Americans? Well, we have the lowest breastfeeding rates in the U.S., yet we are hit hardest by health problems that breastfeeding protects against: diabetes, heart disease, asthma, and allergies, just to name a few. It means that childhood obesity is at an all-time high. It means that we have an unacceptable infant mortality rate for black babies. In other words, we are sacrificing the well-being and lives of these babies because people are afraid to address the root of the problem. The ongoing residual effects of racism has affected the infant feeding choices for black families. You may ask yourself, well, what does racism have to do with breastfeeding? So as we move forward in this presentation, we'll explore the historical, societal, and social barriers that exist for black families as it relates to breastfeeding. So let's look at some historical barriers in the context of breastfeeding for African Americans. And there are several factors. I'm going to touch on a few of historical issues that have residual effects on infant feeding choices for African Americans, and I'm sure I could go on for days about this, so I've narrowed it down to a few. So the effects of the black slave wet nursing her slave master's child at the expense of her own, at the expense of her own baby. So in many cases, the black woman's mistress would not nurse her own child, but rather make that the duty of her slave, therefore making breastfeeding appear as an act of health and not an act of love. The wet nurse was typically a house slave and used for the sexual pleasure of her slave master. She was often the mother of some of his children. So let's take a moment to imagine this for a moment. What this does for the psyche of the slave girl who has to nurse the children of her attacker at the expense of her own children. So oftentimes, while the wet nurse nursed the master's children, she was forced to wean her own children so that the mistress' child could have adequate food. So how about the slave who worked in the field and returned to physically draining work the day after birth? She was unable to nurse on demand, and oftentimes that affected her milk supply. So for the purposes of survival, slave children were often offered food supplements at an early age. And so that's why you might hear talks or you might be aware of early supplementation for black babies at an early age. It actually began as an act of survival, passed down and shown as a way of love. And it just became a cultural custom that continues to be passed down from generation to generation. So let's talk about the rippling effects of slavery and how they have affected, how some parents bond with their child. You've heard one of the barriers is probably, you hear a lot is that the mother doesn't want to spoil the baby. So for years, and even currently, parents feared when their child might be ripped from them at any time. And so in a way to prepare their child for the society, or prepare our children for the society that we live in, there could be a fear of dependency. So preparing children for independence and resilience sometimes begins at infancy. So the psychological impact of the slave experience for African Americans and the experience beyond that continues, and the current experience continues to affect the way that Black families parent, and particularly the rates of breastfeeding and supplementation in early weaning. So let's look at the historical context of breastfeeding for African Americans. So we'll talk about the sentiments around breastfeeding for Black families. And so a lot of times there are negative attitudes and behaviors and ideas about breastfeeding and what those that societal impact has on a mother in her environment and the places that she may attend. Also, imagery. The most popular image of a Black baby feeding is that of a bottle-fed baby. So often I meet women who have, in their experience, very unfortunately, have never seen a baby put to the breast. So putting a baby to the breast is not always a commonplace. And so those images that are projected regarding breastfeeding regarding mothers and babies and feeding choices is typically that of a baby who is bottle feeding. So let's talk about medical support and the cultural appropriateness or being able to have a relationship with the medical support. There are few Black internationally board certified lactation consultants, and I understand that there was a panel convened recently, of which I was a part of the design team, to address this issue and how we can go about getting more certified Black lactation consultants. What you're looking at on your screen is a picture that I took in my neighborhood, and as you can see, it shows free diapers with any 5 cans of powdered baby formula. And, you know, I don't know about you, but typically when I know people who have to purchase formula out of their own pockets, they're not usually buying 5, and they're not doing it at the corner store. So this is one way of street marketing infant formula. And so it talks about it's a little bit going into the attacks on people in their own communities and environments. So we'll look at the last bullet on here about returning to work. Typically, in many situations, not all, but young Black mothers have to return to a service industry job that doesn't necessarily allow them to have flexibility in breastfeeding. So, you know, the scheduling may not be appropriate for pumping at work, or bringing your child to work, or being able to leave work to go to breastfeed your child. So these are just a few of the societal barriers that exist in regards to breastfeeding. So we'll click a little. I mean, we're looking at a picture there from one of our breastfeeding clubs that we have in Detroit. And she says, one Benford mom says, I like the club meetings because not only is it other Black mothers, but it's also a social group for me. So the social and community context includes family structure, social cohesion, perceptions of discrimination and equity, civic participation, and incarceration institutionalization rates. And so we're going to look at and talk about the social barriers that many Black moms have to overcome to successfully breastfeed her child. So let's first look to breastfeeding role models in her social environment. You know, unfortunately, African American families oftentimes lack persons perpetuating breastfeeding behaviors to emulate. Multi-generational support is very often non-existent. Therefore, it's common for a woman to lack an immediate reference point. Furthermore, if a woman looks beyond her immediate circle towards celebrity role models, there are few Black breastfeeding champions. And because there are few examples of breastfeeding, many women have a hard time figuring out how they can fit it into their lifestyles. So let's talk about social support a little more. Kimberly Seals Hours has coined a phrase called first food desert. And so she's defined the first food desert as a community that is devoid of breastfeeding support, where access to breastfeeding support groups and peer support is almost non-existent in these communities. She goes on through her research, and she has shown that in many African American communities, mothers have to leave their neighborhoods and cities to drive double-digit miles to reach the nearest breastfeeding support group. And in many cases, when she arrives at that group, she finds that there is no one there who has any similar socio-cultural relevance, and she tends not to return. So if you look at that picture again, you can see, and you look at that statement that the mom says, I like the club meetings, because not only is it other Black mothers, but it's also a social group. You'll see that breastfeeding clubs allows moms to come together out of their home into a comforting and welcoming environment. Black Mothers Breastfeeding Clubs, Black Mothers Breastfeeding Association offers a replica model for community-based mother-led breastfeeding clubs. In fact, on August 27th at noon, if you go on our website, you can sign up for our model replication informational, and you'll find that just looking on the calendar, and it will be easy for you to sign up to participate in a webinar to get information regarding replicating Black Mothers Breastfeeding Club. When breastfeeding clubs bring a sense of normalcy to breastfeeding, we bring together women in a culturally supportive environment and eliminate the feeling of social isolation, which is the idea that we live in a huge environment and we are alone in what we do. So let's talk a little bit more about sentiments and how sentiment is one social set, how poor sentiments in one social setting is a barrier. So sentiments in many Black communities are shaped by the historical, societal, and social barriers to breastfeeding success. Thus, oftentimes leading to disapproving looks, comments, suggestions, and perplexed thoughts about breastfeeding in a mother's social environment.
This is equality. They have all been given the same amount of support, all trying to reach the same goal to watch the game. However, although everyone has been given the same level of support, there is still one kid who cannot see the baseball game. Sometimes organizations fear giving different levels of support to different groups of people because they are committed to the idea of fairness. Well, what happens when your attempts to be fair fails? Or your attempts to be fair are unjust because, as illustrated in this picture, there is still one boy who can't see the game, even with equal support given to all. Do we just let him stand there sobbing, or do we give him what he needs to reach his goal? When we are facing an inherently unjust, biased, and racist system that has grown on unjust treatment, we must take extra measures to support the group that has been affected by the historical trauma. The question becomes, are you going to do what is so-called equal, or are you going to do what's just? If you could take a moment to notice the picture. When we do what is just, we provide proper scaffolds for those most in need. This image illustrates equity, providing levels of support where needed so that everyone can see the game. Engaging partnerships. So here in Detroit, Michigan, BINFA is partnered with St. John Hospital and Medical Center, and together we are creating opportunities for African American women to be mentored and empowered to become lactation consultants. We have the Mother Nurture Lactation College, which was created through our partnership with St. John Hospital, and together we share a commitment to a community approach to breastfeeding support that has caused us to collaborate on many other levels. This model we are sharing upcoming. So we have our hospital engagement as well as the community approach to support workshop series that we do provide. And as Kadada spoke earlier about our Black Mothers Breastfeeding Club model replication. And all of these things can be found on the BINFA website. So I'll talk a little bit about our workshop series here. And that is a national resource designed to provide culturally appropriate and relevant strategies, information, applicable skills, and action steps to agency employees that have an interest in maternal child health. We have put together a team of highly trained consultants which will go out to service your agencies. And in the past, we have worked with various organizations. We've been supported by the Center for Disease Control and Prevention's Breastfeeding Supplemental Grant in partnership with the Michigan Department of Community Health, Nutrition, Physical Activity, and Obesity Prevention Program. Other previously supportive health departments include the Ramsey County, WIC, University of Missouri, Minnesota, Delaware Department of Community Health, just to name a few. So at this time we have the next slides are our bibliographies. If you just want to take note, I'll take a moment to click through. These will be available.
So we look forward to getting your input, hearing your questions that you may have, and if you want any more information on our programs, you can contact Kendra Rouser. Her information is on the screen, but if you're listening and you're not tuned into, if you're not looking at the computer, Kendra can be reached at kendrar@bmbfa.org. or 1-800-313-6141, extension 6. Again, I encourage you all to visit our website. I also wouldn't be doing my job here if I didn't put a plug in for Black Breastfeeding Week. And you can find information about Black Breastfeeding Week on our Facebook page at Black Breastfeeding Week, which is the last week in August, August 25th through August 31st. And we have, national partners In fact, the United States Breastfeeding Committee will be participating in our Twitter chat, which had over 1 million impressions last year. We have a list of events. In fact, our website will be up tomorrow for Black Breastfeeding Week, so that'll be at blackbreastfeedingweek.org. Again, the list of events is listed at this time on our Facebook page, and there are multiple ways that you and your places around the nation can participate. Again, if you want more information on Black Breastfeeding Week and maybe how to have a local event for the last weekend in August in relationship to that, please visit our website or contact Kendra. We welcome everyone's participation in the second annual celebration of Black families and Black breastfeeding. This year's theme is Black Families Rock. And I think you guys can take the ball back.
Thank you. Thank you so much, Kendra and Kidada. This was a terrific presentation, and I can tell you a few comments that we are getting. Thank you for the mini history segment of the webinar. Very, very informative. And there was a question about all the activities that are happening during Black Breastfeeding Week and throughout this month, and how they could be joining in. And we will be directing people, do check the BIMFA website, their Facebook page. A lot of the activities happening in the last week will be posted on your Facebook page, right?
Yes, most importantly is the Black Breastfeeding Week Facebook page. And again, by tomorrow or late Thursday, we will have a website for Black Breastfeeding Week. So look forward to that, blackbreastfeedingweek.org. We're working on getting it finalized right now with the support of the Kellogg Foundation, who's kind of helping us manage the digital portion of getting the website going.
Okay.
Black Breastfeeding Week, I should mention, is a collaborative MOCA manual, Free to Breastfeed, and Black Mothers Breastfeeding Association, with the support of many, many organizations, including the USBC, Moms Rising, Rose, and so on and so forth. I could go on and on about the supporters.
Terrific. Thank you. And then we've had someone say, tell us more about the program at St. John's Hospital to increase the number of Black IBCLCs. I think there is a lot of interest in knowing more about, how many Black IBCLCs are there. We know we don't collect, there is no data collected at this time, but how is, what is being done to increase the number of Black IBCLCs, especially at the St. John's Hospital program?
Yeah, so one, I should say, we're very proud to be partnered with St. John, who just recently became the first baby-friendly hospital in Detroit. Yay! And the second baby-friendly hospital in the state of Michigan. So about the Mother Nurture Lactation College, what we're doing is we're using the hospital resources to provide mentorship and training for women from the community of Detroit to receive the mentoring hours and the support and the education that they need to sit for the exam to become a certified lactation consultant. And what BIMFA's role in that is to recruit, to help set forth the vision of the program, to provide social support, and guidance and leadership of the program. So we are actually in it's the second year of the program, and we've had our first intern who sat for the exam in July, And so, as you know, those results are not available until October. However, we are very positive and feel very confident in her ability to pass the exam. We also, as a part of the program, have a cohort where we provide action planning, vision guidance, social support, portfolio development, with a group of women who are in Detroit, in the Detroit community, to lead towards sitting for the exam to become internationally board certified lactation consultants.
Thank you. And then
and you can contact him.
Thank you. Another question is the community engagement partnership, the partnerships that you mentioned. Is that like a 4-part series, or is the hospital and the different modules? Is that like a series, or can people want to know a little bit more about that?
Sure. So we offer it as a workshop series. However, we have been contracted to do 1 or 2 sessions. So most recently, we did 4 regional meetings in Louisiana for the Louisiana Health Department and their WIC services. Mm-hmm. And we did 2 workshop sessions per day in 4 different places in Louisiana. We're contracted with the Ohio Department of Health to do 6 2-day workshops in various parts of their state. And Kendra mentioned as part of the Center for Disease Control supplemental grant for breastfeeding that was given to the Michigan Department of Health, we were a part of that to provide this 2-day workshop series in, was it 6 places? Yeah, 6 places throughout the state of Michigan. So we could definitely tailor it to the needs of the agency. If you wanted to contact us, you could contact Kendra, and we would be more than happy to do a consultation with you to find out what your needs are and what our expertise in regards to your needs are, and further direct you.
Terrific, thank you. And we have a question about can we have IBCLCs volunteer to be a mentor in to the program in various states? Can the Mother College be replicated throughout the country, just like the Black Breastfeeding Club? And I know I signed up for the webinar on August 27th about replicating the model for the club, and I know that many others will be signing up. So are there volunteer opportunities for folks to join this program in the replication?
So we are, the program was funded by the Kellogg Foundation, and the goal is to create a model for replication. At this time, it's not available because we are in just the 2nd year of the program. So as we grow and develop the program, learn from the lessons, go back, make changes, further execute, and see what works well and how the community-based organization provides support to the hospital and vice versa. As those things become available, we will be sharing that via webinar, similar to the way that we are doing the information for the Black Mothers Breastfeeding Club. However, if you would like to put your name on a list to receive information about that particular model, again, you can do that on our website. There's a section on there that says for professionals. Just click on there and you'll see the Mother Nature Lactation College. It's a real quick and easy form, and we'll have you on our list so that when the information is available, we'll be glad to share it with you.
Thank you. And we have time for one last question. And where do the clubs usually meet? Are there any venues for these gatherings?
Yeah, so we take advantage of things that are going on in the community in places and spaces that are familiar to our particular audience. So we we have several locations. One is in a community service building, and there are lots of services going on here. It's very familiar to the people. And another place that we meet is at Detroit Community Health Connections, which is a local clinic in the area. And the third place we meet is at a church.
Terrific. Thank you so much, Kidada and Kendra. And as we just heard, BIMFA builds foundational networks of support and strengthens systems to overcome the many barriers that we heard about today, the historical, societal, and social barriers to breastfeeding success. And there are so many lessons in this short, powerful presentations that we learned today. So thank you again. And I am going to turn it over to Larry Grummerstrong, I'm going to unmute you, our chief from the CDC DNPAO, to provide the CDC updates. Larry, your line is unmuted.
Kenny, I'm trying to, it's actually not letting me unmute Larry because he hasn't entered his PIN. So Larry,
Okay.
If you can by chance hear us, we just sent your PIN through the web a couple times, and try to enter that, and we'll try again in a minute or two. But if you want to flip over to our announcements, King Kenny, I see he just went green. Okay.
479.
Larry, can you speak now?
Okay, can you hear me now?
We can. Go right ahead.
All right, I had sent a different pin, but apparently we didn't sync up there, so we're good now. So the first announcement, I just wanted to tell you that we've been quite busy at CDC over the past month, and we were quite pleased on July 31st to release our annual breastfeeding report card. I hope that you all have gotten a copy of that electronically. But I did want to just raise a few of the highlights from that report for you all. The first, as always, we reported the new rates of breastfeeding for the 2011 births in this report card, and rates continue to rise. These rates are based on the dual frame, which means that the sampling includes both landline phones as well as cell phones, so it is a dual sampling frame. And all of these are then not directly comparable to the way that we calculated rates before, only based on landline. If you need to make comparisons to previous years, we would encourage you, rather than using the old report cards, turn to our website at www.cdc.gov/breastfeeding and look at the National Immunization Survey statistics on the website. For the birth cohorts for 2009, 2010, and through 2011, we report the dual frame estimates for those that are comparable across that whole time period. So you can find your state rates for those years as well if you'd like to be talking about your recent trends in breastfeeding. Over the longer period, if you need to look at long-term trends, we do think that the older rates for the landline frame work perfectly fine. The second thing that the report card focuses on is to really highlight the importance of professional lactation support. And so we really highlight the numbers of lactation consultants as well as lactation counselors. And those numbers are reported in the report card with trends. We saw nearly a doubling in the number of lactation consultants across the country and a dramatic rise in the number of lactation counselors as well. We don't have the long historical data on the counselors. So hopefully this will help in expanding access to professional support for breastfeeding, particularly in line with the new reimbursement provisions of the Affordable Care Act. The third aspect of the report card I wanted to point out was the new MPINC scores are available to you in the report card. And we see a nice trend in this where we started with the average MPINC score back in 2009 being 63, sorry, 2007 being 63, that went up to 65, then to 70, and we're now at an average score of 75. So pretty dramatic improvements in the quality of maternity care across the country. The second major announcement I wanted to mention today was new funding from CDC to the National Association of City and County Health Officials, that is NACHO, for the focus on reducing disparities in breastfeeding through peer and professional lactation support. This is a $3 million per year cooperative agreement with NACHO that is focusing on increasing access to peer and professional support in predominantly African American communities. This cooperative agreement will be a mechanism to provide funding to a minimum of 70 communities across the United States that are predominantly African American. That is, at least 50% of the population being served by the community-based organization must be African American. We are very excited about this opportunity to expand peer and professional support. Obviously, we need more to reach the entire nation, but we think that this is going to make a huge difference in the kinds of projects that we can see for improving access. Third, I wanted to mention another funding opportunity that we have granted to the Association of State and Territorial Public Health Officials, or ASTO, in the amount of $750,000 per year. This is funding that will support the remaining state health departments that are not currently funded by CDC for work on breastfeeding. We announced a year ago funding for 32 state health departments that have funds dedicated for breastfeeding work. This funding this year now extends that out to the remaining state health departments, including the District of Columbia, so that we now have funding for all state health departments to work on breastfeeding. The projects that they can work on is a menu approach that they can choose from maternity practices, employment accommodations, and peer and professional support. They can work on multiples of those, but they must pick at least one of those areas. We also expect among those 19 states, in a few of them, we will provide direct funding to coalitions as well in about 5 of those states. The fourth thing I wanted to mention was the MPINC. I already said that the results are out overall. The benchmark reports for the hospitals from MPINC should be going out within the next couple of months, hopefully before we're on this call again. They are in the final stages of clearance here at CDC. So as long as we don't run into any new difficulties, the hospitals should be hearing from us, we expect sometime in September. And finally, I wanted to announce that a research project that we have worked on with the Food and Drug Administration on following up the infant feeding practices study 6 years later, when these children are now 6 years old. That study will be published in a supplement to Pediatrics on September 1st. There are 12 papers in that supplement looking at the long-term effects, these long-term in terms of 6 years later, of various aspects of infant feeding, many of the papers focusing in on breastfeeding. So I encourage you to be looking for that supplement for pediatrics coming out in just a few weeks. So thank you very much for your attention.
Thank you, Larry. And as you can tell, our friends at the CDC have had a very busy time, but it's just so fitting in National Breastfeeding Month to hear about all the very targeted ways that we are together we will be able to work on improving the landscape of breastfeeding support for those communities that have the least amount of help right now. And so moving on, I'm going to hand it over to the Executive Director of USBC, Megan Renner, for the USBC announcements.
Wonderful. Thank you, Kinkini, and thank you, Larry. In fact, while we're flipping slides here, I will follow on to Larry's announcements just to mention that I know Larry just rattled off a couple of big CDC investments in breastfeeding work that will be happening at the state and community level, and I want to assure all of the state coalition leaders on the phone today that USBC is already in close conversation with both of those entities as well as a couple of our other national partners who will be having collaboration opportunities, including some with funding opportunities for states and communities coming out in the next few months. And all of us are actually talking together with the goal not only that we will coordinate as much as possible amongst each other and amongst these different funding streams, both from CDC and from the Kellogg Foundation, but also with the goal that we will engage and involve state breastfeeding coalitions as much as possible. So please do rest assured that we are in these conversations with all of these new partners, and we'll be coordinating information out to all of you as efficiently as we can with these folks. So Kinkini, if you want to flip to, we just have a couple of quick announcements from USBC. Many of you know, many of you were with us last weekend in Washington, D.C., and just a quick announcement that at our August 2014 membership meeting, we did launch a brand new strategic framework for USBC. Many thanks to all of you who participated in the strategic planning process and feedback and listening sessions throughout the spring. There's so much depth and information here that we did not want to try to talk about this in a 60-second announcement here. But we will be devoting our September Power Tools webinar to be a deeper briefing for coalitions about the strategic framework. It's actually undergoing a bit of final graphic tweaking this week, and then we'll be posting it on the website and then having some deeper conversation with you about it in September. And then also, of course, thanks to all of you who attended the 5th National Breastfeeding Coalitions Conference. And again, this is the link to the conference website. Do check back here over the next couple of weeks. We'll be posting final information, session materials, and so on. Will be posted to the conference website there as per usual. And if you want to flip to the next slide, Kinkini, of course, a happy National Breastfeeding Month to everyone. If you have not yet heard, this slide is just showing our overall theme for this month's campaign is breastfeeding in 6 words. And you can see an example of what we're asking participants to do here, to post your 6-word story about what breastfeeding means to you by taking a selfie, and then you can post it on any kind of social media, but especially Facebook or Twitter with the hashtags 6 words and NBM14. So we invite everybody to express yourselves throughout the month with your 6-word selfie photo with your sign. And if you can flip one more slide over, Kinkini, we also have, as we did last year, we have a weekly theme for every week of National Breastfeeding Month. Last week we focused on workplaces in alignment with World Breastfeeding Week, and then this week we are focusing on hospitals, healthcare, next week community support, and then the final week, along with our partners in Black Breastfeeding Week, we will be focusing on families, and you can see their theme and hashtag is Black Fams Rock. Each one of these weeks, there is a Moms Rising Wellness Wednesday Twitter chat that we are co-hosting with Moms Rising, as well as different sets of fabulous partners each week aligned with the topic. So every Wednesday of the month from 2 to 3 p.m. Eastern Time, we hope you'll join us at that hashtag Wellness Wednesday. You can see there on your screen. And then, of course, do visit our National Breastfeeding Month webpage that you can see at the bottom there for social media tools, Twitter tools to reach different legislators about different topics throughout the month. So we invite you to join us in any of those different ways. And again, a happy National Breastfeeding Month to everyone. Thanks, Kinkini.
Thank you, Megan, and thank you so much to our panelists today, Kidada Green and Kendra Rouser. Thanks to Larry and Megan for a really timely and great session from Black Mothers Breastfeeding Association. So until next time, thank you all.